Well, to everyone on the phone today, thank you so much for taking time out to join this session. I don't know if many of you know who I am. If you want to go to the next slide, Colleen, we could do some quick introductions. I am Monica Ho. I am the current board president of NAMI Central Texas. I'm a new board president, so became board president in January. I have spent the last 3 years, though, on the board. So very happy to be with you today. Outside of my volunteer board service, I'm also a chief marketing officer here in Austin for a company by the name of Sochi. If you haven't heard of them, it's a technology platform. But just know I've got, roots here in Austin and a lot of experience in marketing and business. I'm joined today with my partner, Colleen Gallion, who is our existing interim executive director for NAMI Central Texas. Colleen, did you want to say a few things?
I'm looking at the list of people as they're coming in, and I'm like, hi, everybody. Thanks for all y'all early birds coming in. I appreciate it. Excited to be able to share this time with you. And I, I'm going to be kind of functioning as the producer for this. So if you see my eyes flitting over, it's because I'm letting people into the room. The chat should be on. And when you're chatting or messaging, I will be monitoring that. So as you have questions come up, put them in the chat, and then when we get to the end of the presentation, Monica and I will tackle those questions.
Yes. Thank you, Colleen. And you're off video, just FYI.
Oh, okay.
I don't know if you wanted to share your video so we could all
I
see.
can.
Oh,
Hello.
perfect. Thank you.
Hi, everybody.
So, thank you again to everyone for taking time to join us. I know some of you have been with NAMI Central Texas for a decade, maybe decades. Some of you are new. Some of you maybe are here because mental illness has touched you or your family in some way. Whatever brought you here, I'm glad you came. Central Texas is in a moment where mental health support is more needed, more uneven than it's ever been. And families call us in crisis. Hospitals discharge loved ones with a phone number and a prayer. Schools are watching kids struggle in ways that don't have the training to address. And in the middle of all of this, NAMI spent the last 6 months doing something really unglamorous, but essential. We listened, we told ourselves the truth, and we built a plan. Today's session is about sharing that plan with all of you and the rationale behind some of the key decisions, critical decisions that we needed to make. We want to talk about where we're going over the next 3 years and why we believe this plan is going to work. And then finally, what we will need from all of you in the room to really make this real and come to a reality. So that's our goal today. We want to invite you into this plan. As Colleen mentioned, we would appreciate your feedback, your questions as we're going through this session today. You can use the chat for that. Colleen will be monitoring that, so we'll take pauses and try and address questions when we can, but we will have time at the end for questions, so I'll make sure of that. So without further ado, I'm just going to go ahead and jump in to this first slide. What I wanted to start with is just the process that we went through to go into this planning. And there's a lot to read here. What I want you to understand is that at the end of 2025, we did a lot of planning around what we needed to address in the planning process. We also had a board where we had several of our board members changing out because they were maturing off the board. So we have a number of new board members this year. And so part of the thing that we wanted to make sure we did was, knowing we had new board members, was make sure that we weren't actually finalizing the plan until we were able to present this plan to all the new board members and gain alignment. So we did that. Our planning process started with designating a steering committee and then hiring a consultant to help us through the process, which we did, as I said, in late 2025. Before we really dove into that plan, The first thing that we did was we dove into some of the public research that had been done recently in the Central Texas area post COVID. And we thought that was essential because we know how much the landscape has changed, how needs have really changed post COVID. And again, that research, it was pretty plentiful and gave us a lot of really good insight. From that research, we then dove into a community survey. And that community survey, we reached out to our entire membership and asked some critical questions to get some feedback on what was working, what wasn't. Finally, we synthesized all of that data together into a formalized plan that we then presented not only to the new board, we also presented this to our chairs of our advocacy committee, to NAMI Texas, and we got full support for that and finalized this plan at the end of January leading into February. So I just more wanted to give you all some background into the process that we followed. What I'm going to do next is kind of walk you through some of the things that we considered, as I mentioned, and then some of the decisions that we made. So first and foremost, some of the key issues we wanted to consider as we were going through planning was the fact that we've had a lot of instability in our staff at NAMI Central Texas. I don't think that's a secret. Specifically in our executive director role, a critical role that is so essential to the work that we do. And we had to look ourselves in the mirror and ask why. Why is this happening? How do we prevent it? Number one. Number two, we have limited staff. The environment, as you probably all know, is very difficult. It's been very difficult for fundraising, especially with the highly charged political environment. So we've seen a lot of funding areas dry up. And so we have brought down our staff a bit. So staff is limited, but we have a pretty large coverage area. So we have to be really thoughtful about that. And then finally, we needed to be thoughtful about the changing needs in Central Texas post-COVID, as I mentioned. So these were all of the key issues that we put on the table and said, you know, if we had a good plan, that we had to address all of these things. If we go to the next slide, I'm going to talk about the summary of some of the research that we dove into and some of the key findings from that research. Colleen, if you go to the next slide, I still see the key issues that we considered. There we go. So summary of our research, summary of the key findings from the research that we dove into really told us a lot about the needs of folks in the Central Texas area. We looked at community health needs assessments, some of the primary research that had been conducted from some of our partners and local affiliates. We had about 30 different studies that we were able to leverage. And what we came out with were really 6 primary needs in our area. The first being navigation and post-crisis support for families. This came up very high in a lot of the research, again, that was conducted post-COVID. A lot of hospital systems, a lot of our partners saying that there's just not a lot of support for this, but definitely a lot of need. Number 2, youth and parent mental health education. I think we all know that, again, it's post-COVID with all of the different things going on. Our youth is more challenged than ever and really struggling with mental health issues. Number 3, primary care linked education and support and integrated healthcare partnerships. So we know that our healthcare system here in Texas is highly constrained, especially in some of the areas that we reach. And so that was a critically important item. Number 4, culturally and linguistically responsive support. 5, non-clinical support for people in poverty, high stress, and equity zones. And 6, stigma and basic mental health literacy in certain communities. Now, this is not an exhaustive list. If I were to show you all the needs, it would not fit on this slide, but these are the top 6 needs from all the research we assessed. And we really needed this because, again, as I had mentioned, based on some of our resource limitations, we wanted to make sure that when we were coming up with a plan, we were spending our time on the most important areas where we could have the biggest impact, right? So that's what's important about our research findings. On the next slide, as I mentioned, we also did our membership or our community survey. And we did this at the end of 2025, and we got some key insights out of this as well. One of them was we asked our membership, our community, to also rate in the survey areas of importance that they felt were underserved needs and where they felt NAMI Central Texas would be most effective to address. So if you look at the information on the slide, starting with the most important to the least important, our membership and community put, again, navigating post-crisis support for families as number one, youth and family school mental health education is number two, non-clinical support for low income, high stress as three, primary care education is four, and then cultural language response support as five. So again, we have both of these areas that we're looking at. Another area, as I mentioned, we in the survey asked for some feedback, and this surfaced some pretty critical concerns. One being the leadership instability, as I had mentioned, that we definitely needed to address. Number two, inconsistent communication coming from NAMI Central Texas. The fact that there was geographic inconsistencies, and that came from the fact that we said we were covering certain areas, but there wasn't really a presence in those areas. Programs that start and stop. So, we heard that loud and clear. We start something and then like, where did it go? Or we thought it was going to be a continuing series and it's nowhere to be found. Volunteers being underutilized. This one kind of hurt because, we know this organization was built on the backs of volunteers. And then finally, confusion about the role of NAMI National, NAMI Texas, and NAMI Central Texas. So again, we do not have a short list of things that we need to address in this plan, but really in these couple of slides wanted to visualize for all of you the things that we heard, the things that we're looking to address. And hopefully as we get into the details of this plan, you will feel like these things were heard as well. So some of the key decisions, as we looked at the research, we looked at the survey, and we evaluated our resources. Some of the key decisions we made as a team was our coverage needed to change. So as I mentioned, in this very tough environment, our coverage area was expanded, I think right before COVID. We used to be, for those of you that have been with us for a long time, we used to be NAMI Austin, and we really focused on the Austin area. We expanded to 6 counties. And then COVID hit and everything changed. And what we found is, again, because of the funding environment, we were really limited in resources. And if we were going to be effective and if we were really listening to our community, we couldn't say we were going to be in a county and not show up there. So one of the critical decisions we made was to reduce our coverage area. So we wanted to refine our service area from 6 counties to just really focusing on Travis and Williamson counties. This is not to say we won't ever expand into those additional counties again. We would love that. In fact, we would love to support anyone that would like to start an affiliate in one of those counties. And by removing NAMI Central Texas from those coverage areas, it opens up that opportunity. Again, we're there to support anybody that might want to build another affiliate there, as well as give ourselves the opportunity to expand at a point where we feel like we're doing our primary counties justice in serving the critical needs. Number 2, we came up with a phased plan approach to ensure success despite limited resources. So year 1, we're going to really focus on stabilizing our volunteers, getting them back to being, feeling like they're getting good communication, they're engaged, stabilizing our programming where it's consistent and easy to find. And then year 2 on scaling that foundation, and then year 3 on accelerating. And I'll go into more detail there. The final critical key decision that was made was we're really going to focus on four core pillars in all 3 years. Those pillars being core programs, volunteers, funding, and partnerships. Okay, so I'm going to dive into each year of the plan to give you just peel back a little bit of the onion here. So year one, as I mentioned, is all about stabilization. We went through a lot of change. We had to look ourselves in the mirror and really listen to our community based on the survey, as well as all the research that's been conducted. And we need to become a stable, trusted, functional organization with a strong front door for consistent programs and a re-engaged volunteer base. So that is our focus for year one. So reestablishing and stabilizing the core means really honing in on core programming, our volunteer workforce, and finding sustainable fundraising. As I mentioned, this environment hasn't been kind to nonprofits, and so we've got to diversify funding. We've got to be sustainable. Focus two, navigation and post-crisis support for families. Again, this was a top need that both our community and the Central Texas research pointed to first. So it's strengthening the helpline and online navigation tools, creating referral pathways with hospital systems and schools, and improving our findability of support groups and class schedules. And then number three, clarity and strengthen visibility of NAMI Central Texas. From, how is NAMI Central Texas different from Texas and national? Also, really making sure we're increasing our visibility in Travis and Williamson counties. And then how do we rebuild that trust with our important providers? So that's year one focus. Year two is on scaling the core and expanding into healthcare partnerships. So our primary outcome here is NAMI Central Texas becoming a trusted, non-clinical extension of care within the healthcare systems, while strengthening our core programs, volunteers, and funding. So what would continue from year one is core programs remain consistent and predictable, volunteers remain our delivery engine, and navigation and post-crisis support remain the front door. What expands in year two is healthcare becomes the distribution and funding engine. Why this focus is essential, I think, in year two versus youth and school-based mental health, which was priority number two from the community survey, was really because this is the area where we actually have a foot in the door. We have some really critical partnerships already in place. We also wanted to be mindful about all of the changes and regulations that were happening in the school system. And in talking with Texas and national, we're working on some new programming for schools that timed a little bit better to our 3-year plan versus our 2-year plan. So we kind of swapped those two, but there was good reasoning behind that. So then finally, as we look at year three, we want to accelerate our reach through youth and school systems, with the primary outcome becoming the go-to family support partner for both healthcare and education systems in Travis and Williamson counties. Again, we will continue on the core of our programs being the backbone, volunteers still being our delivery model, and navigation becoming our front door. But in year three, expanding into those school partnerships, and those school partnerships becoming a secondary system of entry alongside healthcare inside of the plan. So that's at a high level, the 3-year plan. There's a lot more detail that's in the plan. I'll make sure if you haven't seen the full strategic plan, it's on our website, but we will provide a link to that for all of you so you could read through it thoroughly. What I've got on the slide now is more of the outline. So you could kind of see it side by side, year one through year three. So it's not short of to-dos. We have a lot of work to do. We have a lot to get done. But we're confident, again, in this plan being successful because we've really honed in and focused. We're focusing on the largest needs in our community. And we feel like with this focus, we can really show up strong instead of, starting something and then fizzling out. So that was important to us. So what does success look like 3 years from now? A grandmother whose grandson is in a psychiatric crisis knows exactly who to call, and someone answers. If you click again, I'm sorry, I've got animation here. A primary care doctor confidently recommends NAMI Central Texas resources to her patients as she trusts they will get the support and education they need. A teacher in Round Rock who had NAMI Central Texas training recognizes concerning behavior and is able to appropriately de escalate a situation. And our funding does not come from one big event or sponsor. It comes from a diversified mix of partners who see us as essential. That is what success looks like at the end of these 3 years. Again, this is no way promising that we're going to get here in 1 year. We know we've got to build to this, and we know we need to lean in more than ever into our community, into our partners, and into our volunteers. So, why this moment matters now? As I mentioned, healthcare systems in Travis and Williamson County are actively seeking non-clinical partners they can trust. Those conversations are happening now. Those needs are real. You can look at any of their healthcare assessments, and that's going to be something that pops out. Number two, schools and education. School districts in our region are openly searching for mental health partners for students and families. Their doors are open in a way that they haven't been before. So we're listening and we want to be there. And then finally, other organizations are stepping forward to fill these gaps, but none of them bring the 40 years of family-centered expertise and community trust that NAMI Central Texas can bring. So that's why this moment matters. That's why we're excited about this plan. And ultimately, if we go to the next slide, plans like this don't change communities. Funded plans do, right? So we've done the work of doing the plan, reaching out to partners or community, looking ourselves in the mirror. And I think we've got an incredible plan that will address such important needs in our community, but we do need funding. What we're looking at for the first year of this plan is about $300,000 in funding that we need from now until the end of the year, not to keep the lights on, but to do this really important work. So what we're asking our community is to help us by becoming a monthly donor, a sustainer, by, choosing to donate a little bit of money every month. It really impacts the work that we do. Or give what is meaningful to your household. Every gift is a vote of confidence and will help us continue to do this work. To give a sense of what this kind of contribution could provide, $5,000 in funding underwrites a full year of one core program for hundreds of families. $1,000 trains and onboards a cohort of volunteers and facilitators to lead those important programs. 500 funds navigation and helpline support for a month, and $25 to $250 a month provides a predictable revenue stream that we ultimately depend on. So that's the ask. We've come up with a few of these important giving levels. I think one of the things we want to make we'll do a better job of as NAMI Central Texas and with our partners is to provide things back in return. Again, when we listened to some of the feedback in the survey, we heard a lot about like communication gaps and not feeling like we're engaging our community. So as you can see at the certain levels, I mean, what we're providing here is at certain levels, the ability for important partners to come into some of this work, meet with the board, be part of some of the programming. We are going to be doing annual impact reports that are tied to not just, the things that we did, but tie back to the plan. What did we say we were going to do, and did we achieve that work? And then communication emails quarterly on the impact. So not just the annual, but quarterly result emails and communication so everyone can stay connected to the progress that we're making, the important work getting done. And again, this is for both individuals as well as our corporate sponsors. So That's really what we provided today, just to share with all of you. And I know, for those of you that have been with NAMI Central Texas, it's been over 40 years ago that a small group of families in Central Texas got together because they were tired of going through mental health issues alone. And that's how NAMI Central got started. And every chapter of this organization since this has been written by people much like you, deciding that families coming after them deserved more support than they themselves had. Today, you're helping to write the next chapter. The plan is on the table, the doors have been open, and we know our community is waiting. So thank you for being here. Thank you for all of those who have supported NAMI Central Texas throughout the years, and to those of you who will be supporting us in the future. I hope this was helpful. Again, we've got time if any questions came up during the session. I've also provided a QR code that can give you a really quick way to give if you are so willing. But happy again to pause and take some questions.
And I have switched so that people can unmute themselves. So if, there's not a bajillion of us here. So if you want to unmute yourself and chat with us, feel free.
I'm going to kick us off with just a few questions I know that people have had in the past. As I mentioned, we've presented this plan to Texas, to our advocacy committee. We've talked to national about it. So we've had a couple of dry runs. One of the questions that we've had in the past is like, what if we don't hit the fundraising goal, right? What does that mean? Well, what it means is that, again, we phase the plan further. The goal of this year is really to break even, and we can do that in a number of different ways. I think we're just trying to be really smart about trying not to overextend ourselves. So when we say we're going to do something, we really show up. So the way that we built this year's plan is we're starting slowly, like we've been doing a lot of work to try and re-engage our volunteer base to get our programming back on a consistent, repeatable schedule. And we're being really thoughtful about the work that we're taking on outside of that so that we don't overextend ourselves. And if the funding doesn't come in, we don't put ourselves in a place where we jeopardize the organization. So I also want to mention we've been smart. Like we have some funding in reserve so that we can use that if, for instance, we aren't getting the funding we need, but critical work needs to still be done. But again, the more we tap into that, the more runway we don't have. And we really, again, after this year, we wanna be sustainable as an organization and grow as we can grow our funding, and be really thoughtful about that.
And we have very great questions from Nate. Um, how many people took the community health needs assessment?
So the community needs health assessment is actually there's different ones depending on the organization. We can actually make those available to you. Some of them had 800 survey respondents, some had 300. It really depended on the organization that ran the research and for how long. But what we loved about the amount of research that had been done is we had about 30 different ones that we were able to dive into. And a lot of them were pretty similar in terms of, again, the needs that we were seeing coming up. But if you're interested in that, we could share out the links to the actual community health assessments that we used for this specific plan.
And the next question I will take says, what are the plans for volunteer re-engagement and how will we measure it? Um, the biggest piece that I think is important is the re-engagement has just been good old fashioned me picking up the phone and calling people who were key volunteers and meeting them for coffee or for a Zoom call just to find out where the disconnect was happening. And for those of you who are on the call who are maybe part of our volunteer community, there was an interesting disconnect between what I was hearing from our staff and then this kind of volunteer word on the street around disengagement. So from a staff perspective, we were reaching out on a regular basis to try to get volunteers to help facilitate our core programming, and we're getting nothing back. And then the volunteers were the general message that I'm getting was one of like, put me in, coach. I'm like, okay, we have a disconnect between what people want to volunteer for and what we need them to volunteer for. So that has been a big part of the work over this first half of 2026 is connecting the dots between what people want to volunteer doing, what people have been trained to volunteer to do, and then what are our volunteer needs. And that a big step in that direction has been that we have a part-time volunteer coordinator who's having those conversations and reaching out. The other piece has just been cleaning up the database, so we're clear on who's interested in volunteering and what they're interested in volunteering for. And one of our big measurements for engagement is going to be simply, do we have people willing and able to volunteer when opportunities come up? So from a programming perspective, do we have the volunteers that we need, excuse me, to maintain consistent programming? And on the other side, and this survey will probably go out at the first half of the year. We did one early in 2026, but a good old fashioned engagement survey to find out, are you getting the opportunities to volunteer that you were hoping you would get when you said yes to NAMI? If not, what can we be doing more, better, different? And the biggest thing that I'm hoping to implement in the second half of the year, one of the big things we heard from volunteers is they want to be in community with each other. And the nature of our volunteer programs are such that it doesn't really lend itself to that. So I'm exploring what does it look like to create an online community for our volunteers where they can connect with each other and they can build out community as people who volunteer for NAMI, and then having quarterly events where we can kind of host get-togethers. Also keeping an eye out for opportunities. Like, for example, we had a film screening come up and I was able to get free tickets to this film screening. And so we put that opportunity out to our volunteers, trying to engage our volunteers and let them know that for us, they're VIPs. So giving them those VIP opportunities when they're coming along. Next was, what are the key program metrics that are needed in order to be the go-to for schools and healthcare? In other words, what volume of demand will you expect to need to handle by then?
So we didn't set metrics on volume. I think that's really hard to do, especially right now in the first year where our focus is on foundational and break even. As we get into the healthcare partnerships focus in year two, I think number one, establishing that trust back with our partners is one of our success metrics. So we've got, as I mentioned, we have several large healthcare partnerships that come and support our walk, that support a lot of the different things that NAMI Central Texas has been doing. And I don't know if we've been, the best partner in being reciprocal and doing more work with them. So, for instance, one of the big success metrics for us is bringing programming together to the community. So, one of the big needs we know in the Travis and Williamson County is teen mental health first aid, right? And to give you an example, Integral Healthcare has an amazing program around that type of first aid. And we want to partner with them to help bring that reach into other areas versus, doing a lot of things on our own and trying to promote those things on our own. I think there's so much good work that's happening in our community, and if we focused on those partnerships, and we kind of built programming and promotion together, we could do a lot more together than separate. So those are some of the things we're looking for versus, volume right now. What you will see as you look at our quarterly impact reports as well as our annual, we always come back to volume. How many families and individuals did we serve? So that reporting will be there. It's just not tied to that specific focus, if that makes sense. These are great
I would just
questions.
yeah, I would just add, I think one of the shifts that that we've implemented as a staff is working with our partners to get um, impact measurements. So, for example, when we do the crisis intervention training for the state troopers, I've asked, but we go in, we do this training. We've always tracked the number of like this is the number of troopers in training that we presented to. But what we knew anecdotally is that when they took their assessment at the end of this training, they scored really highly on the content that NAMI is specifically covering. And so one of the things we're looking at implementing operationally is just to continue to get that feedback loop. It's hard to get people to fill out surveys. Everybody on this call knows that. But making sure that in addition to looking at how many people did we impact, trying to get those data points around, did we move the needle? Do people feel more empowered? Do people feel like they know more today than they did yesterday about what they need to do in regard to taking care of their own mental health or the mental health of their loved one? Whatever the purpose was for us being there, did we achieve that goal, so that we can start to add that kind of data into our reports as well.
One other question we often get, and you guys probably saw it in some of the research we did, is how is NAMI Central Texas different than NAMI Texas? And the simplest way I can frame that is, your NAMI Central Texas affiliate is the boots on the ground, right? So although you can call the 800 number when there's a crisis, it's a wonderful service. What your local affiliate is here to do is address our local needs. Again, with individuals in our school systems and in our healthcare partnerships here in Williamson and Travis County. So that's really what a local affiliate like NAMI Central Texas is for: boots on the ground, doing that work in the community, versus Texas, which is working on a lot of legislation and laws and things that are related to Texas and getting mental health services in general. And then NAMI National, again, is all about like the bigger programs, 800 number, like they're the ones that help come up with the core programming, so that that can be scaled across all the local affiliates. So we're the delivery mechanism of all of that work. So all levels are really important, but it's important to understand what levels do what, and we're the ones that are supposed to be addressing the specific needs of our community. So I'm not seeing any new questions. When I'll wrap us up with, and if you guys have other questions, please use the chat. And again, this is not the only time. If you guys leave this call and you come up with a message, or sorry, a question, please reach out to us. We want to hear from you. We want to make sure we're providing the information that everybody needs. But another question that we hear is how do I know that my gift will make a difference? I think, as I mentioned before, you're going to hear from us. We need to do a better job of communicating through our impact reports, through our regular reporting, as I mentioned. And we're going to tie our dollars to outcomes, right? So we'll be transparent about where are we with our funding? What did that contribute to? Did we need to further phase the plan or not? I think that's important for our community to understand. And like I said, we're going to invite our community into our programs, like through this town hall. Give us feedback. Are we missing something? We really want to make sure we're being a lot more communicative.